Hello everyone, a very good evening to all of you. So in this session, I am going to discuss systemic pathology, a very important topic from systemic pathology, that is cardiovascular system. From cardiovascular system, the most important topic today I am going to discuss is one of the type of endocarditis. Many students found this topic very difficult to understand, and you believe this topic is really very important for second Prof university exams. Every year a long question comes on this, and many multiple short and very short questions also come from this topic. So I will explain you everything about one of the type of endocarditis, that is rheumatic fever and rheumatic heart disease. Before starting my session, I would like to ask you 3 questions based on this. Let me assess, do you know the answer before I teach? Right, but after I teach, definitely you all will know the answer of all these 3 questions. So the first question I would like to ask is this: what is the mechanism of rheumatic fever? I am going to teach you rheumatic fever, but do you know what is rheumatic fever and actually what is the mechanism of rheumatic fever? Is it cross reactivity with the endogenous antigen? Is it innocent bacillus effect? Is it due to toxins secreted by some bacteria like streptococcus, or is it release of pyogenic cytokines? Do you know the answer? If you have confusion, please watch the lecture ahead. So the second question is, I'm not telling you the answer right now. Okay. The second question is, all of the following are the major Jones criteria. You know Jones criteria I'm going to teach you today. All of the following are the major Jones criteria in the diagnosis of rheumatic fever except. Don't miss the word except. So there are 4 options. Is it migratory polyarthritis, subcutaneous nodules, chorea, or carditis? So what do you think? What is the correct answer? Why don't you write in the comment box and check yourself in the end. Okay. And the third question is in front of you. A 10-year-old boy, Pappu, died of rheumatic fever. So all can be expected at the autopsy of the child, except. So again, don't miss the word except. So the 4 options are in front of you. Is it a Scop nodule? You will get in the autopsy, yes or no? Is it rupture of chorda tendineae? Yes or no? McCallum patch or fibrinous pericarditis? So why don't you write your answer in the comment box? And still, if you have any confusion, let me clarify your confusion. So let me start endocarditis. What do you mean by the term endocarditis? You know, in pathology, anything is the inflammation of that part. You know, inflammation of that part is known as itis, endocarditis. You know, appendicitis, bronchitis, meningitis. There are many itis in pathology. In pathology, the term itis means inflammation of that organ, of that part, of that tissue. So endocarditis is, of course, the inflammation of the endocardium of the heart. So we know this is a heart, human heart. You can see the heart is having 4 chambers, 2 auricles and 2 ventricles. Heart is having 3 layers. The 3 layers are in front of you. Can you see the 3 layers? Yes, you can see the 3 layers. So the innermost layer, which is of red color, you can see this one is endocardium. The middle layer, which is of black color shown here, it is myocardium, and the outermost layer, which is of blue color shown here, it is pericardium. So endo, myo, peri. These are the 3 layers of the heart. You must understand. Now look at endocardium. Currently I am concerned with the endocardium because I am teaching you endocarditis. I am teaching you endocarditis, not myocarditis, not pericarditis in this session. In this session we are studying endocarditis, right? In the next sessions ahead I will teach you the remaining 2, myocarditis and pericarditis also. But currently we are studying endocarditis. So concentrate on endocardium. So as I have told you, the red color layer, endocardium, it is covering the heart entirely from the inner side. It is the innermost layer, अंदर का layer है ये, ठीक है? So can you see the heart walls? Here I have shown you 2 heart walls, the bicuspid and the tricuspid wall, mitral and tricuspid, you know, the 2 types of the walls. What is the layers over the heart? Do you know over the walls of the heart? Walls पे कौन सा layer होता है? Endo होता है कि myo होता है कि peri होता है कि all 3 are present on the walls? I am asking you. Do you know the answer? Which layer covers the heart wall? So it is only endocardium. So we can say endocardium is of 2 types. The endocardium which is present over the walls of the heart is known as valvular endocardium, and the endocardium which is present everywhere else apart from the walls, this endocardium is known as mural endocardium. You got my point? So here you can see the 2 type of the endocardium I have shown, the mural endocardium and the valvular endocardium. You can see the valvular endocardium is present over the walls of the heart, and you can see the mural endocardium is present over rest of the heart. Can you see the rest of the heart is having mural endocardium? The 2 type of the endocardium. So in endocarditis, both the endocardium will involve, both will get inflamed. I am teaching you endocarditis. Okay? So whenever the valvular endocardium will involve, here the person will have vegetations over the wall. So all type of endocardium have vegetations over the heart walls. But based on the morphology, location of the vegetation, you can identify which type of endocarditis is there. So the classification of the endocarditis, there are two types of endocarditis, the rheumatic and non-rheumatic. Rheumatic is the most common, which we are studying in this session, and in non-rheumatic 3 more endocarditis are there. One is Libman-Sack endocarditis, in which the endocardium is involved in SLE. You know what is SLE? It is an autoimmune disease. The one in which non-bacterial thrombotic endocarditis, in which endocarditis is due to excessive thrombosis in human body. And the third one is the bacterial endocarditis, also known as infective. So these 3 are non-rheumatic. So in this session, I am going to teach you the most important endocarditis, that is rheumatic one. The remaining 3 non-rheumatic endocarditis we will study in the next session, right? So let me start the rheumatic endocarditis or rheumatic fever. So do you know what is rheumatic fever and rheumatic heart disease? Do you know the difference between them? Is it same disease or something related, or they are different? I'm asking you. Yes. Do you know the answer? Yes. So rheumatic fever is an umbrella term and rheumatic heart disease is a part of it. Rheumatic fever contains 5 diseases. Now listen, I'm going to teach you a beautiful story. Listen this like a story. Listen this like a story. Now, by the way, in your university exam, when this question, the rheumatic fever or rheumatic heart disease, come for 5 marks. Or I mean, it is a long question, maybe 5 mark, maybe 20 mark, whatever is your university. So you have to write your answer in these headings. Don't write paragraphs. First write the introduction or definition, then write the etiology, then write the pathogenesis, then come on the Jones criteria, then come on the revised Jones criteria, then describe each of them. Right? So in this way, if you are going to write your answer, you are going to get full marks. That is my guarantee. Okay. So let me start with the introduction or the definition. Can you see I'm going to teach you a beautiful story here. Listen. Can you see a child? Why I'm saying a child? Because the rheumatic fever or rheumatic heart disease is common in child 3 to 5 years of age. So this is a child 3 to 5 years of age. A sketch diagram. Okay. The child is having tonsillitis. Imagine a child having tonsillitis. Now name the bacteria which causes tonsillitis most commonly, either tonsillitis or pharyngitis. It is very common now. We all have tonsillitis or pharyngitis at some phase of our life. Yes or no? So it is very common. So the name of the bacteria is gas. G-A-S. That is group A streptococcus. Group A beta streptococcus bacteria. It is the most common bacteria which causes tonsillitis or pharyngitis. So imagine a child who is having tonsillitis or pharyngitis by gas bacteria. You will say, ma'am, okay, we got it. So there is a bacteria causing tonsillitis in a child, causing pharyngitis. So child is having fever, the throat pain. Okay. So what will happen? The body will form antibodies against that bacteria. You know, the body is forming antibodies against the bacteria. So antibody will bind with the bacteria, the antigens on the bacteria. Antigen antibody complexes will be formed and they will be phagocyzed and the bacteria will be killed. You will say, ma'am, it's a beautiful story, but what is unique in that? The bacteria is coming, causing the tonsillitis. Antibodies are formed. Antibodies killing the bacteria. So what is unique in that? The unique is that on the surface of the bacteria, some antigens are present. That antigens is known as M protein. The name of the antigen is M protein. The same M protein is present on human 5 organs. Human 5 organs. You know which 5 organs? The 2 vital. The heart, the brain. Number 1 is heart. Number 2 is brain. Number 3 is skin. You can learn like skin. Just below the skin, we have subcutaneous tissue, right? And just below the subcutaneous tissue, we have joints. We have various joints. So what are the 5 organs? I learned like this. So it is heart, it is brain, it is skin, it is subcutaneous tissue below the skin, and below that we have joints. These 5 organs have same M protein, right? The same antigen which the bacteria is having, right? So these antibodies which are actually formed against the bacteria, they will get confused. They will think this is also bacteria. You know, the antigen is same. There is a molecular mimicry. This mechanism is known as molecular mimicry. The antigens or the epitopes on the surface of the bacteria is resembling the antigens or epitopes present on 5 human organs. So these antibodies will do cross reaction with the 5 body organs. So these antibodies, can I say, these antibodies are autoantibodies because they are damaging the own body organs. You got my point? So these autoantibodies will come. Can you see? I have drawn the 5 autoantibodies. These autoantibodies are coming and binding, causing the damage to the 5 organs, right? Actually, first they are damaging the bacteria, and then they are damaging the 5 organs in human body because of the molecular mimicry, same antigen between the bacteria and these 5 organs. You got my point? So this is autoantibodies. Please mind my words. Please everyone mind my words that the damage to these 5 organs is not caused by bacteria. That's why it is a non-suppurative disease. There is no pus formation in any of these 5 organs because pus is formed at the place where bacteria will come. But here no bacteria is coming. It is a disease caused by autoimmunity. Body's own immunity is harming the 5 organs, causing the damage to these 5 organs. So the 5 organs will have 5 diseases which are non-suppurative. Can you name those diseases for me? Yes. So the name of the 5 diseases is in front of you. In the heart, the person will have rheumatic heart disease or carditis. In the brain, the person will have Sydenham's chorea, right? In the skin, the person will have Erythema marginatum, right? In the subcutaneous tissue, the person will have subcutaneous nodules. And in the joints, the person will have arthritis, the inflammation of the joint, itis. And it is polyarthritis because multiple joints are involved. So migratory polyarthritis, so in a child having these 5 diseases, the cluster of these 5 diseases together known as rheumatic fever. Have you got it? What is rheumatic fever? So imagine you are a pediatrician, right? And a mother is coming to you with the child, or the parents are coming to you with the carrying their child to you, right? The child is 3 to 5 years of age and they are complaining, doctor, my child is having lethargy, fatigue, edema. That indicates some heart problem, right? My child is having irrelevant involuntary movements in the air, right? Jerky movements. That is the child is having some brain problem, that is chorea. The child is having red color spots, the rash on the skin. The child is having multiple nodules in the subcutaneous tissue, or the child is having pain in the joints, and it is migratory. Sometimes the child will say that I'm having pain in the shoulder, then the shoulder is okay. Now I'm having pain in the wrist, I'm having pain in the elbow. The child is frequently changing the location of the pain in the joint. कभी बच्चा बोलेगा यहाँ दर्द है, अभी इधर ठीक हो गया, इधर दर्द है, इधर ठीक हो गया, इधर दर्द है, like this, So it is a typical history the mother, the parents will give to you. It is migratory polyarthritis. So the first suspicion that should come in your mind is the rheumatic fever. So can I say rheumatic fever is a multi-system involvement? 5 systems of the body are involved, and it is not necessarily that in all the child all 5 are involved. In some child, maybe 2 of them, maybe 3 of them, maybe 4, and in unlucky one, maybe all 5 of them may be involved. So that is rheumatic fever. You got my point? So can you define rheumatic fever with me? Everyone. Yes, what is rheumatic fever? You say, ma'am, it is a multi-system disease because 5 systems are involved. It is always post-streptococcal. I know the bacteria is not causing damage to these 5 organs, but the antibodies are formed because the bacteria is coming in the body. If no bacteria is coming in the body, these antibodies will not have formed and they will not cause the disease, the damage to these 5 organs. You got my point? So it is always post-streptococcal. And how much time will it take? Once the bacteria will come and causes tonsillitis, after 3 to 5 weeks of that, the child will present with these symptoms. So rheumatic fever is always, you can say, a complication of tonsillitis, and only 2 to 3% of the child having tonsillitis will have this complication. You got my point? It is non-suppurative because bacteria is not causing it, right? And it involves 5 organs. You already know the name of those 5 organs. You can say that rheumatic fever is an immunologically mediated disease. It is a multi-system disease where multiple systems are involved, where group A beta streptococcus pharyngitis is causing that disease involving the 5 organs. So that is the definition. So can I say it is an autoimmune disease? Yes. It is not caused by the bacteria. Please mind, it is very important. So the pathogenesis, there is a child. The child is the susceptible host. And when the group A beta streptococcus bacteria is coming and causing tonsillitis or pharyngitis, the antibodies are formed. The antibodies are autoantibodies, and they will show the cross reactivity between the bacteria and the host tissue, the 5 host tissue. You got my point? This mechanism is known as molecular mimicry and cross reactivity. Who are doing molecular mimicry? There is molecular mimicry between the bacteria and the host tissue, the 5 organs, and the antibodies are doing the cross reactivity. Actually, the antibodies are formed against bacteria, but they are doing cross reactivity for the human tissue. Now let me tell you the Jones criteria. Jones is a scientist who has given the criteria to identify the rheumatic fever. So the 5 diseases which are caused in the 5 organs, that is major Jones criteria. In Jones criteria, we are having 5 major criteria and 5 minor criteria. You got my point? 5 major and 5 minor. So the 5 major criteria are in front of you. The first is carditis, that is rheumatic heart disease, carditis. The second, the heart involvement. In the joints, it is polyarthritis. In the brain, it is Sydenham's chorea. In the skin, it is erythema marginatum. And in the subcutaneous tissue, it is subcutaneous nodules. So these are the 5 major criteria. You know, the 5 diseases in 5 organs. These are Jones' 5 major criteria. What about the minor criteria? You can see this diagram also. Can you see a child with the tonsillitis? Appreciate the pus in the tonsil. Pus will be there in the tonsil because in tonsil bacteria is present, right? And these are the 5 major criteria you can see. After the tonsillitis, the child will be present with these 5 major criteria. Coming on the minor criteria. When the child is having tonsillitis, at that time the child have fever. Agreed or not agreed? The child will have high grade fever because of bacterial infection. So fever is a minor criteria. Now please mind my words. In the major criteria, I have told you arthritis. Now there are 2 terminologies. Arthritis and the second is arthralgia. What do you mean by that? What do you mean by that? Itis means inflammation. Algia means pain. Please understand the difference. Arth, the word arth is the joints. So the patient have inflammation of the joint and the patient have pain in the joint. You got my point? What I mean to say. So the word arth means the joint. So joints inflammation and joints pain. The inflammation of the joint is a major criteria, but the pain in the joint is a minor criteria. So you have to take these subtle differences, you know, for solving the MCQs. Now अगर क्वेश्चन एग्जाम में ऐसा आता है कि आर्थराइटिस मेजर है कि माइनर, सो आंसर इज मेजर, और आर्थ्रल्जिया आपका माइनर है. दिस इज अ वेरी फ्रीक्वेंटली आस्क्ड एमसीक्यू एंड कंफ्यूजिंग एमसीक्यू. सो वहां पे मैंने आर्थराइटिस बताया. देखो पॉलीआर्थराइटिस विच इज माइग्रेटरी इन नेचर बिकॉज मल्टीपल जॉइंट्स आर इन्वॉल्व. ठीक है, सो वो पॉलीआर्थराइटिस है, लेकिन यहां मैंने क्या बोला? इट इज आर्थ्रल्जिया. सो आर्थ्रल्जिया इज अ माइनर क्राइटेरिया. फीवर, आर्थ्रल्जिया, राइट. एंड प्रीवियस हिस्ट्री ऑफ rheumatic fever because it tends to recur. ये भी एक minor criteria है. From the lab, 3 things, the 3 blood investigation. If you do the ESR of the patient, it will be raised. If you do the CRP of the patient, C-reactive protein, it will be raised. And if you do the WBC count of the patient, it will be raised. So तीनों चीजें blood में बढ़ी हुई मिलेंगी आपको. ESR, CRP और WBC. That is one of the criteria. If you do the ECG of the child, in the ECG the balls are involved, usually mitral valve. ठीक है? That's why the PR interval will be prolonged. You know in ECG we have PQRST. So PR interval will be prolonged. So these are the 5 minor criteria. You can read 5 major criteria and you can understand 5 minor criteria. 5 major criteria and 5 minor criteria, all of them are in front of you. Have you got it? Have you got it? The 5 major and 5 minor. After that in 2015 there are revised zone criteria. अब बोलो मैम what is the revision? 5 major, 5 minor, we got it. What is the revision? Revision में the major are same, the minor में 1 is removed, rest the 4 are same, लेकिन few more criteria are added which are known as gas criteria. Group A streptococcal infection criteria which are 3 in number. That is the revision. Revision में हमने ये और add कर लिया. आप बोलोगे मैम ऐसा क्यों? Why we have added? So imagine now you are a pediatrician. You have to imagine you are a pediatrician. One child is coming to you with the 5 major, 2 or 3 of the major. The child is having carditis, erythema marginatum and say chorea. Any 3 of these. And child is having multiple minor criteria also. Right? The first question, what do you want to ask the child? After the examining and seeing the symptoms of the child. The first question you will ask the mother, do you have throat pain a few days back? Do you have throat pain, tonsillitis a few weeks back? Right? If the child is saying yes, the complete history is correlating with post-streptococcal rheumatic fever. But what if the mother and the child, they are saying no? The child is not having sore throat. The child is not having tonsillitis. The child is not having pharyngitis. Would you be able to quote all these criteria as rheumatic fever in that scenario? No, you can't. Because the rheumatic fever is always post-streptococcal. So you have to prove that there is some streptococcal infection in the body. And after that, these major and minor criteria are coming. Then only you can say, ma'am, it is rheumatic fever. Otherwise, if only major and minor are there and streptococcal infection is not there, you cannot say, de novo, you cannot say it is a rheumatic fever. So that's why this revision is done. How you will prove the child is having streptococcal pharyngitis? How you will prove? You will say, ma'am, do a throat swab. Just do a throat swab like in COVID we are doing and try to grow on the culture plate. If the growth is positive for the bacteria, it is proven, number one. Sometimes child don't have pain, right? The disease is very mild. It goes unnoticed, but the bacteria is present in the tonsil, number one. Number two, see the blood of the child. In the blood, you should get antibodies against the antigen of the bacteria. Two types of antibodies you have to see. Anti-streptolysin O antibodies and anti-DNase, anti-deoxyribonuclease antibodies. Right? These two antibodies are present in the blood and the throat swab is positive. Any of these. This is known as revised Jones criteria. Can you enumerate Jones criteria to me? Any one of you? Please help me with the Jones, or rather help me with the revised Jones criteria. Please. What are the revised Jones criteria? The first thing you have to tell me, there are 5 major, there are 4 minor, one of the minor is removed, I will tell you. And there are 3 guess criteria. Now you have to enumerate them. Please try to enumerate 1, 2, 3, 4, 5. 5 major. Try to enumerate 3 minor. 1, 2, 3, 4. 4 minor. And 3 guess criteria. We will try to enumerate them. Let me start with the major criteria. The first major criteria is of the heart carditis. The second is the brain, that is Sydenham's chorea. The third is the erythema marginatum in skin. The fourth is the subcutaneous nodules. And the fifth one, what is the fifth one? Joints. It is polyarthritis. Migratory, it is arthritis. Arthritis, inflammation of the joints. Right. Now coming on the minor criteria. The first one is the fever. Right. Second is arthralgia. Arthralgia. It is not arthritis. Itis was major. Arthralgia is minor. Right. The third one is raised ESR, raised CRP, and raised WBC. Right. And fourth one on ECG, you will find raised PR interval. But the recurrent history of rheumatic fever is removed in the revision. Now coming on the guess criteria, the 3 guess criteria. Either do a throat swab and try to culture. Either see antibodies, the 2 type of antibodies. The first is anti-streptolysin O titer and the second one is anti-DNase. These antibodies should be present in the blood of the child. So that will be proven. Now this is the revised Jones criteria you have to write in your exam. Very, very, very important. You can get, if this for short answer, you have to draw this. If it is for long, you have to describe all one by one. Right. Now the next question, how many of these should be present in a child to label the child as rheumatic fever? कितने होने चाहिए? ठीक है. अगर 2 मेजर हैं, any of the 2 major, at least 2 major, तो माइनर देखने की जरूरत ही नहीं है. माइनर हो या ना हो, डजंट मैटर. लेकिन 1 मेजर है तो साथ में एटलीस्ट 2 माइनर होने चाहिए. राइट. और गैस तीनों में से एक तो होना ही चाहिए. यू गॉट माय पॉइंट. सो what is the condition? The condition is in front of you. Either 2 major alone or 1 major along with 2 minor. But always you should get a guess criteria. Guess criteria. That is the revised Jones criteria. So have you got it? Have you got it? Just a second. Let me show you. So now try to answer these 3 questions. I have asked you at the beginning. I guess I have asked you these 3 questions in the beginning and you can answer these questions to me now. I guess you all can answer these questions to me. Just a second. Let me go to the beginning. Now try these answers. You got the definition, you got the Jones criteria. Now we have to describe each disease, each of them. So you can see, this is the first question. Try the answer. Write down in the comment box. What is the mechanism of the rheumatic fever? What is the mechanism? Now you know the correct answer. Is it cross-reactivity with the androgenous antigen? Is it annosant by Slandor effect? Is it due to toxin secreted by streptococcus or is it pyogenic cytokines? You know? What is the answer? Write down in the comment box. I will reply in the comment only. All of the following are the major criteria of the Jones except. Can you tell me which is not a major criteria? Read the 4 options very carefully. This is question number 2. Read the 4 options. Is it migratory polyarthralgia? It is not a major. Subcutaneous nodules, chorea in the brain and carditis in the heart. Which of the following is not a major? I am asking the except. So tell me what is the correct answer of question number 1. Tell me what is the correct answer of question number 2. And tell me what is the correct answer of question number 3. This is question number 3. A 10-year-old boy Pappu died at the, okay, this question you can't answer right now. I have to explain you more. So that's all about this session. Now about the 5 major criteria. That is all 5 I am going to describe in the next session. So stay tuned for the next section. Thank you very much for being with me, giving your precious time to me. And if you like the session, don't forget to click on the like button before leaving. Share the link with all your friends, colleagues, everyone. And please subscribe our channel if you want to get notification further. Thank you very much. All the best. Bye-bye. Study hard.